Hi, this is Vince Joannides, Chief Medical Director at Optimum Re, and this is the Optimum Academy, PrEP and HIV 101, video number 4, Underwriting HIV Positive Applicants. So let's get started. So HIV positive insurance applicants that test positive for HIV and are being treated with antiretroviral medication combinations. New antiretroviral meds are very effective at reducing HIV virus to undetectable levels if taken as prescribed, and they're usually prescribed by an expert in HIV medicine, and they need to be taken on either a daily basis as oral pills or a monthly or injection determined to be monthly or maybe longer, and that's Cabenuva listed at the bottom of this list. But most people are taking oral medications like Biktarvy or Dovato, which are advertised frequently on television. So the history of HIV positive underwriting at Optimum Life Reinsurance applicants and applications on HIV positive applicants have been accepted by Optimum Re for the last 14 years at this point. The applications of these historical cases have recently been re-reviewed by the Optimum underwriting team in light of current improved outlook for HIV positive disease because the medicines are so effective, and new legislation which is now in force. So as in California, Insurance Code 799 says that you cannot decline, as of January 1, 2023, you cannot decline an applicant based solely on the fact that the HIV test is positive. You can look at other factors which may influence your decision. Are there co-infections or other unfavorable factors? But an applicant cannot be declined just on the basis of an HIV positive test result. So the Optimum R&D team on HIV positive disease did a thorough review of our historical HIV positive cases. We recognize that improved antiretroviral treatment is available with improved mortality for HIV positive disease, which basically has become a treatable chronic illness. We reviewed the HIV positive ratings offered by our client companies in the U.S. and had discussions with those companies, and had our consultant, Dr. Steve Rigotti, review the current mortality literature on HIV positive population and recommended ratings. So a new manual section was developed and reviewed by all the Optimum R&D team, actuarial team, medical and underwriting teams, was passed in the underwriting committee, and the new Optimum Life underwriting manual section will be presented. So this is how the section looked. It describes HIV disease and sexually transmitted diseases which may occur in addition to HIV. Talked about the key factors in assessing risk. What's the current state of the applicant in terms of their CD4 T cell counts, and is the viral load undetectable? Are they adhering to the treatment regimen carefully and not missing any medication, refilling all their prescriptions as necessary, and getting necessary follow-up as indicated by their physician? When we look at the risk selection criteria for HIV positive applicants, we look at their HIV viral load, which should be fully suppressed for at least a year. There should be, in regard to the CD4 count, no counts less than 200. Should be the counts for CD4 T cell count should be greater than 350. And there should be no prior events where the CD4 count was less than 200. We recommend using a spreadsheet for underwriters and medical directors to document the the CD4 cell counts and viral load on each date that it's mentioned in the APS, what medication the applicant may be on at that time, and what page they can be found on, so that when we do the initial underwriting and then any auditing of HIV positive cases, these mini spreadsheets are very helpful. And this is what the mini spreadsheet looks like. We have the dates listed to the left. What is the CD4 cell count on those dates? Is the viral load basically undetectable? What page number is this noted at? And what is the treatment regimen that the applicant has been following? In considering the rating, as we said, the CD4 cell count should be greater than 350. We should have undetectable viral loads, so less than 200, but basically we want it closer to 0. Regular follow-up, testing and adherence to the outlined medication regimen, absence of comorbid diseases such as cancer or heart disease, and hopefully the diagnosis was made early and treatment before any appearance of unusual infections. Things we would consider unfavorable are any history of AIDS-defining illnesses. We don't usually see those anymore since the medications are so effective if they're being taken as prescribed. But any other comorbid diseases that would be adverse includes chronic hepatitis B or C that is not cured, any history of lymphoma or leukemia, history of IV drug abuse, history of other substance abuse in the last 10 years, or ratable coronary artery disease, cancer, or vascular disease. This is a list of the AIDS-defining illnesses that we used to see in the past. It's unusual to see any of these complicating a case at this point. You'll notice that herpes simplex is also listed. We're not talking about simple herpes simplex outbreaks, but we're talking about major, widespread herpes disease that would suggest an AIDS-defining illness. So that completes this video. Stay tuned for video number 5 to complete the PrEP and HIV 101 series.